Hello folks, hope you are doing great. So before starting with this segment, let me make you people a little comfortable with few terms which I would be using during the course of this video. When I say SCI, it means spinal cord injury. Paraplegia means paralysis of lower limbs and quadriplegia means paralysis of all the limbs. So now when we are comfortable with these terms, let's start our discussion by answering a very important question like what is spinal cord and why is it so crucial in our body? See, spinal cord is the main pathway between the brain and other parts of the body. Let's understand this with an analogy. When we press a switch, the bulb lights up. Here, the wire connecting the switch and the bulb can be understood as spinal cord. If we damage this wire, the electricity will stop flowing and the bulb will not light. Likewise, in our body, when we damage the spinal cord, the information from the brain to the other parts of the body below the level of the injury will not reach and hence paralyzing the parts of the body below the level of the injury. So now folks, when we have understood what is spinal cord, let's debunk few myths surrounding spinal cord injury, and I think these myths have a lot in common with people having spinal cord injury and those who have other conditions because of which the mobility of the patients are compromised. Myth number 1. With proper rehabilitation, an SCI guy can resume his or her normal life. Such people can start going to schools, colleges, their work, go movies, go shopping, drive a car and do all the stuff which you want to do. SCI people even play physically strenuous games like tennis, basketball and whatnot. The only thing that changes here is the way you transport yourself. So instead of going around on your feet, now maybe you require a wheelchair or a walker. The only issue that you will be facing here is the attitude of our government and few of our ignorant architect friends who do not understand the importance of ramps in public places like multiplexes, footpaths, etc. Moving on to myth number 2. Spinal cord injury in two people will always be different based on the extent of the injury to the spinal cord and the location of the injury. If two people in a similar accident cannot have same wounds and same cut marks, then how can two people have similar spinal cord injury, same effects and a similar recovery pattern? Myth number 3. No, an individual can sever his or her spinal cord without an accident also. Infections to the spinal cord, compression of the spinal cord by the spinal disc in your vertebrae column and spinal tuberculosis can also be a reason because of which the spinal cord gets injured. However, the main reasons still are falls from heights and road traffic accidents. Moving on to myth number 4. Unfortunately, there is no complete cure for spinal cord injury. Undergoing surgery and then undergoing intense physiotherapy, you can resume your normal life. However, the extent of the recovery cannot be determined. It can be a complete functional recovery, partial functional recovery or no recovery at all. However, a point that should be noted here is that people with SCI do not have to live on medicines. They take medicines as any other guy. Moving on to myth number 5. I get a lot of questions regarding this. Do you work? Are you able to work? How do you go to office? Do you work part-time? Do you get less salary? Negative, negative, a lot of negativity surrounds this. Now, to answer the question, people after the injury can be financially independent. They can become lawyers, architects, engineers, or take up any other vocation or profession that they want. The injury does not restrict you from working. This injury can definitely slow you down, but it can never stop you. You can achieve whatever you want to achieve. Now moving on to myth number 6. Many people with disabilities are as competent and as independent as people without them. It's just that they do things a little different. But if you really want to help, here are a few things that you could do. Provide an accessible parking and please do not occupy them. Advocate a barrier-free and inclusive environment so everyone gets an equal opportunity to compete. And please do not stare. Please do not stare when you see someone using a wheelchair or walker, as it can make anyone uncomfortable. No one likes to be stared at unless it is from a pretty girl with a pretty smile. We'll be wrapping up this video here and we'll be coming up with a new video very soon. Till that time, please like, comment, subscribe and share this video so this can reach to people who really need it. Till next time, have a blast, have a great and awesome new year. See you again. Bye.